Patient hand hygiene. Patient perception of participating in hand hygiene in the ambulatory outpatient setting by Ryan Cooper. Background and issues. Hand hygiene is key in infection control and patient safety in the healthcare setting. I chose this project to increase proper hand hygiene in the immediate care centers. I also did this project to increase patient satisfaction by increasing a patient's feel of being safe against contracting diseases in the immediate care, such as COVID-19. A review of evidence-based and scholarly literature was conducted prior to the beginning of All Hands In to evaluate the need for patient and visitor hand hygiene in the ambulatory and hospital setting. The literature was collected through St. Mary of the Woods College Library online webpage. The database used in researching was Cumulative Index to Nursing and Allied Health Literature, or CINAHL. The keywords used in the search were patient hand hygiene, importance of hand hygiene, and hand hygiene and infection control. In this research, I found expert opinions on proper hand hygiene, including expert opinion on implementing patient hand hygiene in the healthcare setting. I also found ways to educate patients on the importance of hand hygiene and proper washing and sanitizing techniques. Another article that I reviewed provided expert opinions on hand hygiene according to the Joint Commission during the COVID-19 pandemic. The registered nurses and staff of the immediate care centers should have a bigger part in education and encouraging the use of hand sanitization stations and proper hand hygiene to every person that enters the clinic. This would increase the use of proper hand hygiene, decrease the spread of disease, and increase patient satisfaction. The people that were involved in this project included the unit manager, the nursing staff, the front desk staff, the medical doctors, the clinical educator, the nurse practitioners, and the physician assistants that all work at the immediate care centers. How I did this project was I connected with the staff at the immediate care centers and asked if they could start encouraging patients to use their hand sanitization stations when they get into the clinic, before they go into the exam room, anytime they leave the exam room, and before they leave the clinic. I also asked them to educate the patients and visitors on why it was important that they needed to sanitize while in the clinic. I also posted a QR code in every room that stated that it was a survey related to the patient hand hygiene and if they could take a few moments to take the survey. The survey was also handed out with their discharge paperwork. The questions in the survey included, on a scale of 0 to 10, with 0 being no concern at all and 10 being the most concerned, how concerned were you about visiting the immediate care center during the COVID-19 pandemic? Did you delay coming to the immediate care center because of concern for your personal health during the COVID-19 pandemic? During your most recent visit to the immediate care center, did you have easy access to hand sanitizer stations? During your most recent visit to the immediate care center, did the staff encourage you to use the hand sanitizer? How many times during your visit did you clean your hands using either hand sanitizer or with soap and water? Do you feel the precautions taken by the staff at the immediate care center, including your participation in hand hygiene, helped alleviate your concerns of being exposed and/or transmitting infections? And then the last question was for them to provide their thoughts on being encouraged to participate in hand hygiene during their visit and if they had any further suggestions. Altogether, I got 41 responses in 3 weeks. The results are displayed on the next slide, and I will go into further detail on those. So on the question on a scale of 0 to 10, with 0 being no concern at all and 10 being the most concerned, how concerned were you about visiting the immediate care center during the COVID-19 pandemic? 23 out of the 41 responses answered 0, that they had no concern. This surprised me because I know that a lot of people have been nervous about going out. So I was surprised that 23 people showed 0 concern. From 1 to 10, there's 2 or 3 in each of those categories. On the question, did you delay coming to the immediate care because of concern for your personal health? 90% said no, and only 9.8% said yes, that they delayed their care. I was also surprised about this. My thoughts were during the COVID-19 pandemic, people might put off going to the immediate care center for fear of contracting COVID-19. During your most recent visit to the immediate care center, did you have easy access to hand sanitizer stations? For the 41 responses, 100% of them said that they did have easy access, which is really great, and I was really happy about that. During your most recent visit to the immediate care center, did the staff encourage you to use the hand sanitizer? Only 75.6% said yes. I was a little disappointed with this because I really wanted the staff to encourage and educate every patient that came into the clinic during these 3 weeks. I understand, they're busy and they may forget, but I really would have liked to see that, yes, higher than 75%. How many times during your visit did you clean your hands using either hand sanitizer with soap and water? 24 people said when entering the room. 23 people said while in the room or during the visit. 24 people said exiting the room. And only 4 people said that they did not use hand hygiene during their visit. I was pretty happy with these results, that most of the people that took the survey did use some form of hand hygiene at some point during their visit, which I think is great. Do you feel the precautions taken by the staff at the immediate care center, including your participation in hand hygiene, helped alleviate your concerns of being exposed and/or transmitting infection? Out of the 41 responses, 90.2% said yes. 9.8% said no. I really would have liked that to be 100% of the responses felt like their precautions helped alleviate their concerns. I understand that if they did not, but I was pleased with the results of my survey, and I think it definitely shows some room on where the immediate care can do better and where they can grow from here. My recommendations for next steps would be to educate the patients and staff on the importance of continuing this hand hygiene. I would also want to encourage the staff and patients to perform hand hygiene and involve the patients in observing hand hygiene performed by nurses and staff. I was very pleased with the outcome of this project. I expected to have more survey responses, but given the short time frame, I was happy with the responses that I did receive. If I could change something about this project, it would have been to have the survey run longer, but with the time constraints, I wasn't able to do this. I learned a lot about implementing a quality improvement project in the healthcare setting. I learned how to submit the product idea to the board and all the steps that are included in getting the project approved. I was very happy with the staff involvement and cooperation with this project. I was limited in this project by the inability to go visit the immediate care centers regularly to evaluate the process due to the COVID-19 restrictions. I conducted a lot of the project steps by email with the registered nurses that work in the immediate care centers. I ran the survey for 3 weeks so that I had enough time to complete the rest of the project. I think if I had been able to run the survey longer and be more present in the immediate care centers, I could have had a better outcome.